last place that I like to release involving the posterior pelvic region for the sciatic pain is the pectineus muscle. And although that's an anterior muscle that comes up from the front and attaches just into the back here, it's difficult to get to it, and one of the ways to do that would be to lift the hip and bend the leg to tree position on the right, and then moving over to the left side and working right into the soft spot, the most medial of the gluteal crease, and feeling for the ligament back here, the sacral ligament, and then just below that you're palpating the medial side of the ischial tuberosity. So going in there, I like to place an elbow so they can give sustained pressure at that point that the muscle inserts. And to get there, you want to drop in an elbow right into this soft point, feeling for the bone of the ischial tuberosity, and drop in and sort of move your way into against the bone. And so I'm going to go down and then back. So positioning myself to where I can safely do this, I'm going to press down and then lean forward and go back. And now I'm right at that most medial side of the ischial tuberosity where that pectineus attaches. And I'm just going to rest down and allow my elbow to just melt through the tissue and help that release. A way to check that is that I like to watch the foot begin to evert. And so once I get in my position and begin to feel the relax of the fascial tissue melting, I like to watch the foot position change. Sometimes when there isn't a significant change in the lower portion of the foot and sort of an eversion move, that would actually show me that the pelvis region has let go fascially. But sometimes that restriction will run down through the medial side of the leg, through the semitendinosus of that hamstring. And so I would go only to the lower bottom portion of the leg, the thigh, and drop through and feel for any fascia restrictions, which I do feel right here. And as I palpate, I see the foot begin to move into the rest of the upright position that I'm trying to achieve. And so working through these fibers of just doing some compression and a little bit of cross fiber, breaking up that fascial tissue has allowed the foot to go into the position I'm trying to achieve, which is upright and straight, where the Achilles tendon is directly down from the center of the back of the knee, right down through the calcaneus. And then I'm just going to continue to do some release to this muscle to complete that.